Again, welcome everyone. Hello and Happy New Year. Welcome to our first webinar of 2022. My name is Jen Braun and I direct the AHA Team Training Program here at the American Hospital Association. We're excited to have you join us for our webinar, which is a sneak peek to one of our breakout sessions at our Advancing Care Conference. More to come on that soon. But our webinar today, Applying Human-Centered Design to the Improvement of Healthcare. So we're excited to have you. But before we get started, just a few rules of engagement to highlight. For some of you who come to our webinars frequently, you'll notice that we're utilizing a new platform, Zoom. Fortunately or unfortunately, depending on how you look at it, many are familiar with Zoom at this point. But as a reminder, you can access audio by listening in through your computer speakers or through your phone. If you're having issues with either one, you should be able to change that and just check out the toolbar at the bottom to switch your audio. Please note that you're in a listen-only mode. All hyperlinks that you'll see on the screen are live, and we'll also support that in the chat. And then further, I'll be moderating a Q&A session at the end with our speakers today. So if you have a question throughout the webinar, please feel free to chat it in. If it's logistical or technical by nature, we'll answer that in a moment. But if it's for our speakers, we will save that for the end. We are happy to offer CEs for our webinars. In order to claim your CE credit, you must create a Duke OneLink account. This is a one-time only setup, and my colleague Kara will be chatting in those instructions, and you can refer to the email that was sent out this morning with the attachment as well. Following the webinar today, please text TEVFES to the number you see there. We will be sharing the phone number and the code periodically through the webinar and again at the end for your reference. In terms of upcoming events, we have our monthly webinars as always on the second Wednesday of every month. Registration is open for our February 9th webinar, which is also another Advancing Care Conference sneak peek, which is on managing healthcare conflict using emotional intelligence to build safety culture. And as always, we have our online community platform called Mighty Network, which contains exclusive content. It's really just a great way to connect with your peers across the country who are interested, not only just in team steps, but team training too. Finally, our Advancing Care Conference is taking place. It's right around the corner in Chicago, March 7th through 9th. If you've been to former team steps or AHA team training conferences in the past, you'll see similar themes surrounding team performance, quality improvement, well-being, and education and facilitation. And this conference is really aimed at those in healthcare who get things done. It will take place in person in March, but in the next 2 weeks, we'll be opening our virtual pre-conference experience. And so this is exclusive to conference registrants, and they'll get access to complimentary virtual pre-conference workshops on design thinking and free resources and tools from our partners in the field. It's also a great opportunity to connect with other registrants who are coming to the conference, along with speakers from across the country. And the in-person conference in March is going to be highly interactive, and there's going to be a large emphasis on human-centered design thinking, which is a really great segue to our presenters today, Matt Kelly and Marc McLaughlin from DoTank. They'll be presenting a breakout session and a final keynote, so you'll see their influence and their hands across the conference. So with that, I'd like to introduce you to our speakers today, Matt and Marc. Over to you guys.
Awesome, thanks, Jen. Marc, why don't you introduce yourself first, and then since I got the first section, I'll take over and take it from there for a wee bit.
Sure, thanks, Jen. Thanks, Matt. My name's Marc McLaughlin. I'm a partner and business designer at DoTank. Have enjoyed wandering, some wild and really inspirational challenges within the healthcare space. So very happy to be here today and share some of our experiences using human-centered design approaches in healthcare.
Yeah, and I'm Matt Kelly, a partner and also a business designer with DoTank. The majority of my attention is in the healthcare space, and thank you to the AHA for hosting us today. We've had the pleasure and honor of working with you guys for years on conferences and team training and all kinds of cool stuff. So very happy to be here today. So a little bit about how the next 55 minutes or so are going to go in terms of kind of pace and tone and hopefully outcomes. So what we're going to do is we're going to move really quickly. So Mark and I are going to bounce back and forth between a few kind of case studies, some canvases, some tools, hopefully talk a little bit, and inspire you a bit with different ways you can facilitate conversations, gather people together, and move meaty, important challenges towards improvement over time. So again, for this time, we're going to move really quickly. We're going to bounce back and forth. We may have some time for questions. We'll see how the pace kind of goes, but please do use the chat as you go. So for us, just a little bit about us. So we started as a unit and a team in 2014 and then branded as DoTank in 2017. And right from the start, we were human-centered design innovation group, right? So we did a lot of thinking about value proposition design, new products and services, and understanding consumers and this sort of thing. And we naturally found our way towards healthcare. And at this point, by far, most of our work is actually in the healthcare space. It's just such a natural fit between this empathy-rooted kind of human-centered approach to problem solving, breaking down complexity, bringing people together, and a mission/industry that's really focused on human beings. Not only that, as you guys know, it's complicated and it's dense and there are silos and it's hard to make change and people are bandwidth strapped. So the fit between human-centered design and healthcare is so natural and awesome, right? In terms of the fundamental shared mission around improving people's lives and then the complexity of the space. And we've worked with a whole bunch. This is a small sample of, we've worked with health systems, associations, tech companies, and that sort of thing. So across the board, it's been a pleasure to kind of see the space. And we've really had the pleasure of sharpening our practice in the space across a couple of really key areas. So today, we're going to take you through, I don't know, Mark, I think it's 5 or 6 of these areas, and show you a little bit of a story. And we've designed some custom tools and things that you can use going forward with the work that you do. So, classic kind of human-centered design 101. Start with the people for whom you're trying to create value, convince of a point of view. Start with what you're trying to achieve, right? So start with the folks that you're trying to influence. So for us, this is 101 stuff. I imagine many folks on the call are, familiar with empathy mapping, different tools, or they be this one, for example, designed by the great Dave Gray and the folks at X-Plane. So let me start by talking a little bit about a canvas. So if you haven't used one of these before, and you'll see a few of them here today, these are simple structures to hold complex conversations, right? So whether you're designing a whiteboard or you're printing one of these out, 2 feet by 3 feet, or you're importing them into a digital whiteboard space because you're working virtually, these things help you structure conversations, capture data, and move in a sequence through topics. So empathy mapping is key. So you can see here some of the key things that we do with empathy mapping is we start with the cognitive and emotional experience of the person, right? So this could be the patient, the physician, a colleague, a senior leader, whatever it might be. And trying, although it's impossible to do, try to walk in their shoes, so to speak, and think about what their experience is. It really comes to a core and a center, as you see here, with pains and gains. And we're going to introduce a brief solo exercise in a moment here. But when we talk about pains and gains, we're talking about what are the things that keep this person awake at night? What risks do they observe? What obstacles do they perhaps struggle to overcome? Gains are, what do they dream about? What would exceed expectations and make their experience and hopefully their lives marginally better? So classic kind of value proposition design is often rooted in these terms of pain relief and gain creation. But before you can create the thing, the offer, the process, the wayfinding through the emergency room, whatever it might be, it starts with trying to understand that person that's going to experience this. So before we start the 60-second timer, the job for you is to think about someone in your life and what are their pains and what are their gains? Who's your target audience that you are trying to influence? Okay.
And when we think about this, Matt, because we obviously live this every day with people that we work with, when we think about empathy, typically it's boiling down to how do you make something relevant for those individuals, that individual human or that collection of human beings. Why would they care? What's in it for them? What really will help them, what helps the very problems that they have daily, weekly, monthly, whatever it may be. So relevance is such a massive part, right, of empathy mapping. We can empathy map to the nth degree, but actually focusing in on the things that really will make a difference to them is, maybe it's not 101 empathy mapping, it's 102. It's just that next step towards it being a little bit more rigorous.
Well, if you don't create something, and this could be not necessarily a product, but just a pitch for resources that resonates with the experience of the person that you're trying to influence, if it doesn't resonate, you don't have much of a shot. And the impulse is often to start with the thing that you care about, the process, the service, the solution. But human-centered design is kind of all about starting with the person you're trying to reach.
Yeah. So into the world of business design thinking, one of the things that we hear a lot is noise on buzzwords. Innovation, collaboration, design thinking, human-centered design, sprinting techniques, business model innovation, visual thinking, agile, lean, and on and on and on the terms go. So when we look at all of the methodologies that are out there, all of the tools that are out there, of which there are plenty, our job constantly is to simplify and to make things relevant for customers to do powerful things. We look at that through the lens of 4 main areas. We've got design thinking, which is classic empathy, really starting with the end in mind and the people that it affects. Visual thinking, which is like the power of consumption, aligning, underlining the power of storytelling principles, then kicks in rigor through business model innovation. What does the business model look like? What's the back end infrastructure, the front end channels, the core value proposition, all of these parts of business modeling that makes things very rigorous. And then there's speed, the speed of doing things, using sprinting techniques. And all of that boiled together is what we call business design thinking. Design thinking is one part, but business design thinking are those 4 fundamental cornerstones. So the question for you, Matt Kelly, is, how might that emerge within healthcare organizations? Where are we seeing, real value? What are some of the examples that we have that we can showcase that are real? They go beyond, the academic exercise of the 9 million tools that we have, in the armory. And we've got some examples, right? So the first one is within the space of quality improvement. So take us through a quick 4 or 5 minutes on this QI example.
Yeah, absolutely. I mean, quality improvement in particular, improving the outcomes, the lives of patients, collaboration amongst groups, processes, everything like that is just a beautiful match for kind of human-centered design. So here's a particular case study, a project that is one of my personal favorites. We were able to do it for a number of years with the Illinois Health and Hospital Association, where it was kind of this, we had these sprints, and it was all about identifying best practices that have kind of emerged organically within, in this case, some Illinois hospitals, refining those processes and the associated materials that will enable them to spread to other locations. So one of the reasons why I'm so personally fond of this one is there are a lot of innovation, quote, innovation challenges that pose a question and ask people to pitch in ideas, half-baked things, and those are wonderful. But this was an experience, and this happens at all of your sites, necessity is the great mother of invention, right? And you've got teams in the ED or in the back end of the office that, because they have to do something differently, actually create better ways of working. But in most cases, they're doing it for themselves and focusing on their day job. They're not focusing on refining it and spreading it to other locations. So we've found that there's all these kind of hidden gems, if you will, of best practices and really cool ways of doing things. And we partnered with the IHA to source some of these. And we did this over the course of a couple of years. We ended up doing about half a dozen. And the idea was that we would spend the first half of the year with the source site, in this case, the awardee or the group that kind of, was selected, to really understand what they were doing. And then the second half of the year was really about spreading it to another location. So human-centered design, how does this kind of fit in, right? So you've got this source site, you've got the odd Excel sheet, you've got a Word document over here, you've got this kind of scrappy assortment of associated tools that they've used to build the plane as they're flying, right? So since we had the end goal of spreading it, we'd spend the first half of the year thinking about what's the vision for this? What impact is it trying to achieve? Who are the beneficiaries, the patients or the clinicians, and how does it specifically create value for their experience? Because if you ever want to spread a best practice or something, if you can't create a compelling reason why someone else should want to do it, you are absolutely doomed. And empathy mapping, storytelling, human-centered design helps you really understand the fundamentals of that story and why someone else should care. So we spent the first half of the year getting the ducks in a row, getting the associated materials, and building these playbooks. And we did it on a few different things: ED recidivism, interdisciplinary safety huddles, C. diff reduction, antibiotic stewardship, community-based partnerships, a whole bunch of different things like this. There was this really magical moment halfway through. And the message I kind of want to share with you guys as you're out there trying to move something from one place in your organization to another is try to support that spread by creating experiences for the new place. In this case, it was a share site, literally a completely different health system. So these were arguably competitors, right, in Illinois. And you can start this thing really quickly. So we've got some playbooks for these things. We'll share the link where you can access them for free. But a simple way to start is to create a 60-minute session and help that spread site or that new location think about their goals and their ambitions. So you're not starting, right? This is the key human-centered design part. You're not starting by giving them an instruction manual and a sales pitch about how this will make their work better. You're starting by tapping into their needs and their desires, and then tuning how this improvement, this quality improvement, can resonate and connect with their experience. So the second half of the year was a beautiful spot because we had some big urban health centers partnered with small rural critical access hospitals. And so the concept of spread, God, I wanted to keep talking about it, Mark, so I'll stop. But the beauty here is that creating experiences for people when spreading quality improvements gives them the opportunity to create a deeper understanding of what the thing is and a sense of ownership that's personalized to them. And when you have understanding and ownership, you have a much greater likelihood of succeeding. So again, there's a whole bunch of these playbooks that you can try out for yourself and some tools, and we'll reference this later at health.dotankdo.com. You can go there and download some of those playbooks. So that's an example of human-centered design and quality improvement.
I think I can guarantee that if anyone wants to hear more about that, Matt Kelly certainly has energy to share it. It was a very good experience, and you can tell that it lives in his blood. Right. So example number 2 is one for Mark to share, and it's around the topic of clinician engagement. So, what are we talking about here? What we did quite a few years ago, and again, it was with the American Hospital Association. It was actually the Physician Alliance part, if I remember rightly, Matt, within their space. We decided to focus on the problem of burnout, the very complicated conversation, massive, problem to tackle, but doesn't live in our everyday lives in terms of something to discuss. So how do we tackle that, and how can we design, and we co-designed a tool called the Clinician Burnout Canvas to try and help facilitate that very complicated conversation, which we've done at scale, we've done it in individual levels. And Matt, please feel free to jump in with some examples if you think any spring to mind. But what I'd like to do here is explain the construct of another simple looking tool that holds the complexity of a very very delicate conversation for clinicians. And I'll describe it in two ways. There's two main dimensions to this tool. So there are 4 quadrants. If we are saying the objective for our conversation is to discuss and look at options for change that will either reduce burnout or, remove burnout within our system. What can we start doing that we're not doing today? What can we stop doing that we absolutely are spending time and doing today? What can we do more of, and what can we do less of? So a fairly classic 4-action framework structure that allows us into, the conversation at quite a high level. So good. Let's open the doors. Let's have 6 physicians round a table. Let's dig in and have this complicated but important conversation. That's dimension 1 to the tool. Dimension 2 is looking at the inside out part. So yes, we can discuss start, stop, do more of and do less of, but what does that mean at the personal level? So for me, Mark, as a physician, I'm not a physician, but if I was a physician or a clinician, what would I personally want to start doing or stop doing? What would then make sense for my system, the system and the environment that I work within? Trying to look at the dimension from inside the person to the system to then beyond the system itself. What are some of those things that we can discuss, debate, agree with, disagree with, and have a very, very robust conversation around to try and land on options? And this is a collection of some examples from a variety of discussions that we've facilitated over the years. What options can we as a collective genuinely consider? And with everything that we have when it comes to strategic conversations, what can we take away in terms of commitments to change? So it's fine to have the dialogue, and sometimes we just need the safe space to have these types of tough conversations. But what can I personally take away, and what can I use to then infect the system? Now, Matt, you've definitely been involved in more of those high-end, high-volume conversations within this space. What memories do you have of using this tool? What aha moments can you recall? Your own experience of this, because we know this has been a tough one, right?
Yeah, absolutely. I think the beauty in this one is the simplicity, right? So, especially since it's such an emotional topic for people, having a structure like this where people can actually kind of organize their feelings and their thoughts, that's where I've seen it be especially cool. So I've seen clinicians, nurses, physicians, technicians within the system kind of bounce. I think what's really neat are the 2 inner circles, bouncing between. You can facilitate this in different ways. So for a tip to you guys here that might use this canvas is you could start and have, say, the first 5 minutes be a solo ideation around your personal, and then, post-it notes, whether they're digital or physical, put them down. And then from there, think about how can we as a collective make change. And this thing, Mark, I think is really effective in a couple of ways. And this is a recurring theme for these canvases, is every post-it note's a data point. So yes, you can use this as an executive leadership team to think about what's our strategy around wellness in next year. Sure, you can. You could also have subgroups of workshops with 6 clinicians in a group times 100 across your system, and hear and cluster common themes and put things together. So a really important thing here is these things are multifaceted in terms of the outcomes. So yet they can build strategy, but you can also gain data and insights and just use them to get people talking. Sometimes it's hard for emotional topics to create the conditions where people feel safe sharing their ideas. And a tool like this is, the beauty is its simplicity. It's pretty effective.
And that's my main memory, Matt. I think there was a session we ran quite a few years ago in Chicago, and it was a small intimate. I think there was maybe a dozen or so physicians. And I remember the prep discussion that we had with the person that we were working with. And it was around, we need to be really careful because Dr. X is this type of person, they're not that open, they don't talk very much, their time's limit, all the usual stuff that when it comes to engaging with physicians. Dr. Y is a different, person. We need to be mindful. So it was all this care and I think I remember you and I being a little anxious going into the session. When we opened it up and set the climate and allowed them to actually use this for the conversation, I still remember the chat with you afterwards saying, what was the one that was supposed to be spiky, or who was the person that was supposed to be hard work, because they were all great, allowing those conditions to enable the tough conversation in a way where we're just offering structure. All it is a simple structure for very complex conversations, whether it's a physician burnout canvas or a game plan canvas or a value prop design or a culture change canvas. They're all the same, right? It's just allowing them to have the hard conversation in quite an easy way, dare I say it.
But one thing to add, Mark, and I know I'm speaking at the level of generality here, but so hopefully not out of bounds, but physicians, clinicians can often be very literal in what are the exact instructions and how does this thing work. So another facilitation tip is know the conversations you want to have, give clear, simple instructions. You still need to leave some free space for people to explore, because that's the point, but just kind of know, how you're going to guide people through it.
Yeah.
Cool. All right. Another topic, and obviously a very important and also very complicated one. So there's similarities and there's a lot of emotion and complexity and challenges with this topic. And some of my colleagues with DoTank have done a lot more work around here, but I can take it through some of the things that we've done. So our work in this space started with the AHA. So it was the Institute for Diversity and Health Equity, I think it was 2018, asked us to design an interactive experience at their annual conference. And then we were told we have 1 hour and to build a canvas and a tool, create something interactive that's an alternative to a speaker, just to kind of shake things up a bit. And we did. We created a tool that is very similar to this. And it's one that it was our good fortune, landed with folks, and we were able to do it with some health systems afterwards. And the basic idea, super simple structure here, is for people to talk about what are some of the foundational supports that we have as a system or as a society. Again, you as the facilitator get to choose what level of altitude you're segmenting the population. Is it hospital, system, nation, whatever, right? So what are these kind of supports that we have? What are some things that maybe we're not doing so well today, some challenges, but also what are some positive things, some things that we're seeing across our community, however you target that, our community that's really good and really great. So again, this is really simple, but these are complicated conversations. And a very specific thing around this project that we had with the health system, this maybe will resonate with some of you guys, is this was a multi-site system. So they had, 6 to 10 hospitals or something. And the flagship 200-year-old main building hospital was in all of the TV ads, on all of the print articles, right? So it's funny that there's this sense of inclusion, not in the justice, gender, racial sense, but inclusion of the different groups within the organization to create versions of this canvas that we did at each different site. So they felt like they could see themselves in it. So we have a team of really great artists and visual designers on our team. So we created versions of them for each system, but still fundamentally the same structure. You can see where these things can get really far more intense as well. This is a relatively recent one that we created that's drilling down into much more deep topics. But the idea here is specifically around diversity and health equity. It's creating structures that allow people to talk freely, but yet still make progress and gather data and real insights, right? So it's a real challenge for us. This isn't easy stuff. It's not. But how do you get that really good balance of giving people a safe and free space where they can communicate, but also make sure that you're making progress and you have a job to be done as leaders. You're learning things from the group so that you can make changes, right? So everyone's got jobs to do here, but you want to create a safe and meaningful space. So you can see this is just to show you a contrast that this is a real big one. And Mark, in the next slide, you'll drill down. This is a detail of that bigger one that I just showed to show that you can ask specific topics. So when we design canvases or tools for organizations, if it's for an event or for a thing, it's human-centered design. We start with the end in mind. What are the conversations that we want people to have? And what are the information and insights that we would like to gather from them? so that hopefully we can create something and improve things that have more meaning and resonance for their work and for their lives, right? So in this case, you can see we dive really deep into some of these diversity and health equity issues. So again, some of our colleagues at DoTank have done a lot more deep dive work into this than I have, but we've got some cool subject matter expertise that we partner with as well. It's interesting work. So yeah.
Great. Yeah, and I think, Matt, similar to the clinician burnout stuff, tough topics, but some proud moments for us in terms of feedback that we've had. You know, some of the impact. It's again, ROI in the innovation space can be tough. You know, we can talk about that through some other things as well. You know, you invest in this innovation stuff, whatever that term may be, but the result is what, you know, from saving lives to culture change, whatever it may be. It could be at both ends of the spectrum. So I think there's some real pride in our team and the people that we've worked with in that area, which is again not easy. Okay, right. So shuffling on then to some more examples, I am going to talk about probably one of my favorite ones, and it's in the strategic innovation space. And I'm going to guess that Jen Braun will have a wry smile on her face because we're going to talk about Solvathon. Target audience for this, again, starting with our audience in mind, we're a couple of hundreds what had been classed as next generation healthcare leaders with a fairly open-ended, broad problem to solve at the highest level that we dug down into around how might we, you know, reimagine some healthcare experiences, which we then double-clicked into 4 specific swim lanes in 4 areas, you know, of interest. So enter the American Hospital Association, Solvathon, San Diego 20, I don't know, was it 18 or 19? Anything pre-COVID feels like a blur, at least to me, where we brought together a few hundred folks, randomly brought them together in 24 innovation teams. Imagine them as individual startup businesses or brand spanking new teams that were formed around specific challenges, and let them go at 4 unique customer segments that were centered around either a specific problem to solve or some opportunities to create. So when we imagine the human-centered part of this, one, they knew what some of those challenges were coming into this 8-hour experience, literally one day, you know, coming together in this fabulous space in San Diego and being given a ring-fenced environment. This is again, very pre-COVID, which is why it's one of my best experiences. A very ring-fenced environment for, you know, teams of 6 to 8 people, the 24 pods to work on something very, very real with, in most cases, strangers, people they had never met before in their life. But they were all of the ilk of next-gen healthcare leaders with that desire, you know, to make things happen and, you know, make real change. So we designed a very analog experience for them in the day where you can see, you know, roughly what these big walls look like, where we wandered them through a process of framing the challenge, you know, some ideation around some solution concepts that might work. Let's build some rigor into how it will actually operate. What does the business model look like? What's the value proposition? What are the routes to market? How will it fly? And ultimately helping them design a storytelling-esque pitch towards the end around, right, what do we need? And, you know, let's make this thing actually work. We've done some shuffling in the room, if I remember rightly, on the day where they got to test it with other teams and other interactions and get some feedback and tune it and iterate it. And there was all this energy, I would say, lots of excitement, lots of Post-its and stickies, which typically is what people imagine when they think about innovation. But they were data points for us, to Matt's earlier point. Every single Post-it or stati is information that we can gather and collect and analyze. You know, and the net result of this was most if not all, of the attendees absolutely absorbed something that they could take away and use in their daily working life, whether it was a new tool, a new concept, a new way of working with people. And ultimately, you could see just the general energy and inspiration that was showcased and absorbed across, a couple of hundred people, in parallel to the AHA's annual conference happening in the same space, the same week, I think, and around them. And I think that, Matt, you were there as well, because we were both on stage with Jen and Chris Hunt. My biggest takeaway from this was, I think, the multiple aha moments that you could hear at tables, people in the pods, talking to folks that they'd never met before, but learning things, challenging each other, inspiring each other, and every single team, all 24 of them, landing on some very decent and quite well-rounded solution concepts, right? That typically ideation sessions can be quite weak and they're very conceptual. They're not, they're not that rigorous. I think this was a fabulous way to inject human-centered design approaches to rapid strategy design, across those problem areas. What was your main memory of that experience?
Well, that human-centered design experiences are the best networking. There's nothing like having people work on a shared challenge to get to know each other quickly, especially whether it's a conference. So Mark's talking about one of our service lines that's unique. It's this high impact events doing conference stuff, and can't wait to do the Advancing Care conference soon. And but when you've got folks that just get into it, but this, trying to give meaningful advice to you guys in attendance here, I think it extends. Like, if you're trying to break down silos or trying to create greater collaboration across a system or a site, you're really in the art of experience design. So a more micro level are these canvases and conversation design, but zooming back out, and it doesn't have to be as grandiose as this or in a ballroom, it's about creating the experiences that allow people to share and get to it, rather than stand around and figure out how many kids each other's have and what neighborhood they live in and spend half an hour small talk, So yeah, that's a big thing for me, Mark, is just the sheer power of its networking and bringing people together.
There's a moment in that, and we've done many kind of conference-esque things like this. There's a moment that I think you and I have enjoyed over the years where, because we know what we've designed, because we know the very conversations people are having at any one point in time, whether it's a empathy, led thing, whether it's digging into some conceptual ideation, whatever that may be, that point of the art of conversation, not listening to two bald guys on stage, like me and you, whoever, but actually allowing them to converse and dig in and engage, and listening to the actual energy in the room go from silence to real noise I think is a special moment. So if you can recreate that in any way where you've helped design a conversation for people to have, a very important one, and sit back and listen to it, and that's phenomenal. I think I love the power of that. And again, it's one of those simple things that human-centered design allows us to bring to the table. It's not all about post-its, it's not about the tools, it's the conversations that these people are actually having, and the alignment and the ahas and the commitments that they make to go and do something different. Right, Matt Kelly, showcase.
All right, this is our final example here, and this is one we're really in the thick of right now, and I think it's a pretty cool one, but we want to showcase how you can take critical, emergent, and distressing situations, such as what we've all experienced for 2 years or whatever it is, such as the COVID-19 experience, and human-centered design has a role to play in real time. What emergency preparedness, after action reporting, reflecting on what occurred, pulling out things that you've done well and embedding them, and looking at areas where you can improve and innovating around them. So we have #everything here because it really does tie together innovation and quality improvement and clinician engagement and community-based partners and the whole thing, right? So let me kind of share how it worked, because these two, Mark, in contrast, are kind of almost the two ends of our practice. On one end, you've got this like really cool, colorful, exciting one-day thing, but most of our work is actually over time on big challenges, whether it's redesigning how we handle downtime for our communications technology, to how do we as a population of 3,000 employees think about COVID, right? So we have this long-standing relationship with a health system, 3 hospitals, 1 critical access, 1 kind of flagship, and 1 in between. And this was really cool. We've been working with them for a while. And it started kind of early in COVID as typically when we do an emergency response thing, an after action report, like they gave the example of a few weeks ago, there was a water break in the cafeteria. So we got around what happened, what could we have done better, that kind of thing. We're like, this COVID thing affects everybody. It's an emergency of almost unprecedented scale for us as a system. So we had the how might we question at the time of how might we help all departments and all groups across the system try to process what this experience has been like and learn from it. And then how can we extract insights from across the system for us to understand what happened and tell the story in the future for what is truly a seminal moment in the history of our globe, and of course, at a more local level, hospitals and health systems. So at current rate, these are some of the numbers. We've run numerous workshops. So we designed a 3-hour workshop, which all these tools I'm going to show you are on the Healthcare Innovation Hub, and they are free. So I think there's been some questions about the tools. You guys can access them. And of course, Mark and I are happy to talk about them. But this is the big picture. And you can see in the next slide some of the departments that we've worked with. So we've done this in partnership with some of the emergency response teams and the chief innovation officer and the chief medical officer. So they were some of the sponsors involved in this. And we've rolled it out. So each one of these departments, and I know there's a lot of slashes, so it looks like more than 13 departments, but each one of these departments had a 3-hour session. And the conversations were very different in each case. And some of that has to do with, well, there's lots of variables, like when it occurred. Of course, people are burnt out and bandwidth strapped. And do they feel like they have time the luxury to reflect on their COVID experience and all kinds of different things. Some folks, this was all digital too, right? So we've shown you a lot of Post-it notes and pictures of things. This was all done on Mural, on Zoom. It was all remote. So then you have the facilitation challenge again of like, do some people know how to use digital tools? What's the learning curve? Anyway, that's a whole digression I could get into, is how do you do human-centered design in the digital landscape? I'll put that to the side for now, for a future time, right? But these are some of the groups that we worked with. And basically, we'll take you through we'll use the canvases as the visual, but these were really the 4 conversations that we had. Again, just trying to give you an example of how human-centered design can help you have difficult conversations and improve things, even when they're around the opposite of designing a new product or something that people often associate with design thinking, right? So we started with the group and did kind of a variation of a journey map. Journey maps are very classic and common tools in the space. And this is a slight modification of one. But we started by thinking about what were the key moments for your department or team, not for the enterprise or the organization, right? But for your team over the course of X amount of months, right? So this was the date when Dr. Smith, told us that we were going to build a tent out in the parking lot so we could start seeing patients, right? These kinds of key things, right? And then we went on the reflection of what worked really well over the course of this journey and what didn't. So this first exercise was kind of about taking inventory and reflecting and remembering what the experience was like. This is a mad dash that we've all been through, and it's really easy to forget what happened. So just giving people the space to try to remember what the journey's been like has immense value. So once we highlighted these kind of key areas of success and areas or shortcomings, the next 2 exercises are tied to those. So Mark, the previous one was about success. The next one's about flaws. They're almost kind of the inverse of each other. But the second one there about success was, we go back to old habits very easily as human beings. And I think a really missed opportunity for folks during the COVID experience has been, when the going gets tough, people have done amazing things. And external circumstances have inspired incredible and instantaneous and efficient changes in ways of working. A common thing we've heard from across teams is, we have never prioritized better or more quickly made decisions. It's a very common thing that we've heard. And you know what? That's a fragile discovery, because when bandwidth returns to normal, or whatever normal is, right? Or, and, you know, beds hopefully become less populated, it's really easy to go back to old habits, especially in a complicated, often siloed industry or, you know, workplace like healthcare. So we realize there's two sides to the coin, is take the things that you've done well, and as a team, design around what can we do to embed these things and make them durable. Really important. So that was the first one. The other one was more of an innovation exercise, the next one, which is what are areas where there were shortcomings, and we do a quick ideation. How could we have done things differently? What are some possible, what could we learn from other organizations, right? So a classic kind of think about some new ideas, a gallery of options, and then think about, like, you know, how can we make sure that we make progress with these? And if it's a specific emergency response scenario, what might be the trigger that would, you know, have this new behavior come in, that sort of thing, but more of an innovation one here. And then tying it together with the final one, please, I ask you all, if you haven't had these design conversations or sessions or workshops with folks, I know that this might be obvious, I don't know, but please end with at least a basic critical next steps, if not something like this, that's a more time scaled kind of action plan. So we end by actually getting, what are the tasks? Who's responsible for it? Because if people don't put their name against it, it's unlikely to happen. So you have this plan to embed these best practices. You have these new ideas about how to do things better next time. You know, how can you actually do things to make sure that happens? So the whole point of this, tying it together, and I'll end here because I'm getting long-winded on this topic, is this allows you to use the emergency of the last 2 years to help people try to organize their thinking, understand what they've done well, take steps to take those positive things and make them more an enduring part of the way they work, and think creatively about how they can improve, not only so they're better prepared should another emergency come, but so that they can generally learn from this experience to become a more effective team. And again, we did this all digitally. This is a screenshot of a mural board. Again, we're just trying to inspire you guys with different ways of doing it. It doesn't have to be in person. It doesn't need to be a pen and sight. There are challenges doing things digitally, but there are also advantages. You don't have to transcribe all the Post-it notes and take pictures of the workshop walls. It's all there, and you can work asynchronously. So if your team is willing, people can do things on their own. You can anchor it to homework and things like that. So Mark, just since this was kind of like the tying it together example, I'm curious, what would you add, or what have you kind of observed around this journey we've been on?
I think, other than Matt, the impressive nature of pace, you know, and how quickly you bring people into these conversations, regardless of where they are in the organization. I think that's impressive. And it's not always about, you know, the senior folk or the innovation folk or the people who are wired to think this way. No, this was for everyone, every single, and I think that's very impressive. Right, so then, by way of a subtle wander back towards Jen, before we talk about, you know, the kind of final conclusions, you know, what if we just weren't sure where to start? We've got all of these different areas within healthcare, so many opportunities for change, so many wicked problems that we're all faced with, you know, short term, long term, whatever that may be. So the intention with the Advancing Care Conference, from our perspective, which is why we're delighted to be involved in it, is we're asking the target audience, of which I'm hoping some of you, if not all of you, will be there. These healthcare professionals who, you know, are wired to put ideas into action and make real change, is to bring your own challenge. So, you know, part of the prep for people coming to the Advancing Care Conference is to come with a challenge in mind. Through the experience of, you know, March 7th through 9th, which I can't believe is actually as close as it now sounds, which is cool. They will be inspired, they'll be engaged with different ideas. The coming together part at the end, which is where me and Matt will hopefully be on stage together, is to try and help them sense make the inspiration and the ideas that they've had, and as change makers, how do they take those concepts from an event and take them back home and actually influence some form of change, or start the journey of pitching concepts or pitching, ideas for change to stakeholders within their world. So our job to be done, which is another example of employing human-centered design techniques in healthcare, is to inject some superpower around storytelling. So the storytelling principles that we'll give them ultimately are skills to influence and enable change, whether that's just simplifying concepts, whether it's building trust, whether it's being far more transparent with your ask, whether it's being bold, with what the thing is you're trying to, all of these different things have to be cooked into a story that makes sense for a target audience where there's relevance, back to that same word that Matt kicked us off with, relevance, which means understanding your target audience. So that forces us to consider looking at storytelling. So when we attack storytelling challenges through human-centered design, we break up storytelling into the story, as in the content design, who's it for, what's the relevance, what's the value prop, what's in it for them, to the telling, which is the channels that we use and the actual strategy that we will employ to influence, that change, which we could talk for another 5 hours around. And it's underpinned by these principles of applying head, heart, and eyes techniques to your story designs. So the head is around, convincing the brains that what you're telling is true and factual and logical. And it's got data points that back you up. It's structurally sound, it's rigorous, there's a business model, there's all of these different things. Logic, data. Then flanked by some emotional connection. So when Matt described the empathy map, there was, what keeps that person awake at night, what do they dream about, and what are some of the emotional levers that you can take advantage of to trigger their mind and influence decisions. So how do you sing to the heart through emotion? And then when it comes to eyes, how do we take advantage of these amazing visual processors that we have using visual triggers, visual metaphors? How can we make use of that visual recall ability that people have by visual thinking? So logic, emotion, and visual triggers for visual thinking. And really amplifying that with a mindset, and this again is where human-centered design really kicks in, a mindset of prototyping. Whatever we start with can't be precious, and it has to be allowed to change, which means if I cook up a concept as a result of something that I heard at the Advancing Care Conference in Chicago in March 2020, I can't be precious that that is the thing. So I'm going to take my idea in a prototype mode, and I'm going to share it in as many ways as I can with the stakeholders, the target audience that will support that level of change, and listen and ask for feedback and genuinely accept the feedback in order to tune the very thing that we'll do. So the net result that we're after, if we think about, some data points, if we've got 500 or so, attendees at the Advancing Care Conference, our job to be done is to try and spark and enable 2,500 validation conversations as a result of the event itself. So every single person comes with a challenge. They are wandered through the experience and inspired. We'll help them sense make their concepts so that when they leave the event, their 30-day challenge will be to go and talk to 5 stakeholders who are part of that context for influencing the change, and therefore sparking, hopefully, some sort of change. Again, quite a simple example of employing human-centered design to ultimately changing things within healthcare. So Matt Kelly, rapid replay then. The value of human-centered design in healthcare spread across all of those small, weird, wacky examples that we've just shared. Where do you want to start?
Well, let the slides do the work, right? And then we'll hand it over to Jen. So hopefully we've communicated effectively that there's broad application. So it helps improve outcomes and patient experience, helps improve quality and the spread of best practices, not just across a hospital, but it could be across a system, across a nation, right? That it helps you have complicated but important questions. So for example, diversity, inclusion, equity. You can use these tools to help engage folks and learn. It can help you engage clinicians and try to understand better their challenges and give them a forum and a place to speak and to share and hear from pairs. So clinician burnout itself is served by clinicians just talking with each other. It helps you design and test new products and services. Classic innovation stuff. It's still very effective at that. And it helps you deal with emerging critical challenges. Simple structures for complex conversations, also complex situations, right? So it helps you kind of deal with things as they come up. So this is kind of a little bit of a side project for us, but there's some really cool stuff here. And a lot of the canvases and the playbooks that we talked about, you can find here at health.dotankdo.com. And then if you'd like to learn more about our different practice areas and the work we do, there's a little icon at our main homepage on dotankdo.com, the healthcare one. Click into there. There's subpages and content and videos and all kinds of stuff like that. So thanks a lot for coming today. I really appreciate it.
Yeah, thank you. Jen, back to you.
Thanks so much, Matt and Mark. You guys know this, it's been a pleasure working with you for the last several years, and we really look forward to the conference that's coming up. Apologies that we did get to some questions. I know the Do Tank team was kind of monitoring that and can follow up with the individuals as able. Just a few general reminders. Please complete the evaluation form. As soon as we end this webinar, a new internet browser will pop up with the actual evaluation form. So just a reminder there, we really value your feedback. Big thanks to the team. This was our first Zoom webinar. Thought it went really well. So again, thank you very much to Kara and Emily for the support there. Final reminders regarding CE credit. You'll need to create a Duke OneLink account if you have not already. If you've done that, don't worry about it. But once this webinar is over, you can text that code there to the number on the screen. I'll leave it up here for a moment. Again, Kara, if you don't mind chatting in the AHA Advancing Care Conference link, just so folks have that, along with our email too, if there are questions. We really look forward to seeing some of you in person. And again, that kind of pre-conference experience will kick off in a couple of weeks. And again, you'll see Matt and Mark's hands in that with some of the virtual workshops that will take place before the in-person conference in Chicago. So with that, hopefully we will see a lot of you again in the future. So thank you for joining us today, and we will end the webinar here. So have a great day, everyone.